It's really a great pleasure for me to be with you all today. My task today is actually to talk about trifecta anti-allergic solution, and I will clarify quite soon what this word means. Of course, this is a Sanofi-sponsored symposium, as you know, and being this the case, my disclosure of interests. But let me introduce the concept of trifecta. Why is this important? Well, because first of all, we have to talk about a fast relief of symptoms. The second point is this is not sufficient. Why? Because we need also a long-lasting effect to allow once-a-day administration of the treatment and no drowsy effect. Now, let me analyze a little bit what are actually the evidences that can support this kind of approach. Well, this is a study with radiation-sensitive people studying an environmental exposure unit, because this is the way to analyze in the best placebo-controlled randomized study how fast a treatment is working. And being this the case, the demonstration was that fexofenadine is able to work within 60 minutes and much better, of course, than a placebo. But this is a key point: fast onset of action. Now, what about the long-lasting effect? This is a difficult study, but I will try to summarize easy. Well, first of all, we are talking once again about seasonal allergic rhinitis patients, receiving different dosages of Fexo, 120, 180, then cetirizine, and of course, placebo, as you can see here in the diagram. And for each different symptoms, and the evaluation was for 24 hours. And as you can see, actually, both cetirizine and the two doses of fexofenadine, they demonstrated a long-lasting effect. And I think that it's important also to evaluate that both, to underline, sorry, that both 120 and 180, they were able to give, to keep these long-lasting effects. Now, let's go to a pediatric population, because this has to be investigated in a separate way. And this is the case for different studies, 3 studies in patients till 11 years old, looking at nasal and ocular symptoms. And the effect was clearly in favor of fexofenadine compared to placebo. And but we have to think about something that probably we are not sufficiently considering. What's the burden of allergic rhinitis? So, well, this is something that Michael Blaise quite recently published, and it's a more concrete and complex evaluation of what we are usually doing. And this is for kids and adolescents. And that's the reason why I look at absenteeism. When we are talking about, young kids, we have up to 21% absenteeism of parents. And this is improving the age of course, the patients. But if we are going to productivity, please keep it in mind, this is important. Well, as far as the severity is, of course, increased for adolescent, and of course there is a direct link between severity of the disease and the work and the impairment for the adolescent, but the productivity of the parents is almost dramatic in terms of more than 10 days a year, which is really unbelievable. Being this the case, look at the other side of the coin. Why? Because whenever we are talking about that there was an impairment in performance, what about the examination grade? So the real exit, the real outcome. Well, the real outcome was that increasing the pollen counts, there is a decreasing in examination scores. And this is a key point. But the second point is that the more high is this, and the lowest is the performance in the school. And I mean, once again, we are talking about 12 to 18 years patient. But when we are talking about 15 years old, well, there is a decrease when is increasing the symptoms, but there is an even worse decrease in grades when an anti-allergic medication is used. Being this the case, how much this costs? Recently, with Jean Bousquet and some friends and colleagues, we published a revision of allergic rhinitis, and we reported that data from literature are currently saying that the loss in work productivity in the European Union per year due to the allergic rhinitis is between 30 and 50 billion euros. And the cost of productivity should be seen in a different way. For instance, look, the primary diagnosis, this is a cost, there is a productivity loss and a work loss. And this is due to allergic rhinitis. But if we are treating with a sedating antihistamine, the productivity loss is jumping much higher level as also the work loss. Now, is this also due to sleep disturbances? And for instance, in kids, we have decreased cognitive and psychomotor activity. We have impaired school or sport performance, as I showed you briefly before, and there is a difficulty in concentrating. And Glennis Scadding actually reported that sedating antihistamine are no longer recommended in this euphoria algorithm as far as allergic rhinitis in childhood, and concluding that the first generation antihistamine has not more reason to be used, whereas there is good evidence for the use of fexofenadine, which shows least brain penetration. And this is a key point that I wish to evaluate with you. This study is a randomized controlled trial, showing that Fexo is not drowsy, but mainly demonstrating why this is the case. And in fact, using PET, actually, you can see here that there was a comparison between placebo, cetirizine, and fexofenadine. And if you look at the occupancy of H1 receptors in the brain, you will see that there is no difference, look at the colors, between placebo and fexofenadine, whereas this is not the case for cetirizine. So in other words, The psychomotor tests were not affected because fexofenadine is not different from placebo in the occupancy of H1 receptors in the brain. And now it's not drowsy. Why? This is a double-blind placebo-controlled study with the chlorpheniramine looking at the nocturnal sleep. Sorry. As you can see, this is in adults. No effect of Fexo on REM sleep or reduction of REM sleep, which actually was the case for chlorpheniramine. The decrements in performance was observed with the first, but not with fexofenadine, and also different outcomes such as vigilance, working memories, affected by chlorpheniramine. They were not by fexofenadine. Well, another important point is the evaluation in kids. These are different studies from patients from 6 months to 2 years or older, 5 different studies. Combine all of them, as you can see, as adverse events. In general, there is no difference between placebo and Fexo 30 milligram twice a day. But if you look at the 2 studies showing investigating placebo 15 milligram or 30 milligram once a day, actually there was no difference. And if you are using the twice a day different dosages, once again, there is no difference compared to placebo. So the conclusion is that there is no drowsiness in this study. But I think that probably one of the most significant one is the randomized controlled trial, fexofenadine 360, promethazine, and placebo. And this study was conducted using the evaluation of driving a car. In that, I mean with a placebo, with alcohol, with promethazine, with alcohol, Fexo 360 milligram, and placebo. Once again, this was the capability to brake car, stop the car when driving over 100 kilometers per hour. And as you can see here, actually fexofenadine was equal to placebo, which actually was not the case with the older antihistamine of the first generation or alcohol. Not sufficient? Okay, let's go to the pilots of aircrafts. And to control them, let me go straight to the points. Different kind of possible errors. There were, no significant difference compared to placebo, whereas using cetirizine, this was the case. So I think that this is another piece of evidence. And then, incidence of drowsiness and fatigue, the combination of the two, that was once again in this multi-center double-blind placebo-controlled study using 2 different dosages of fexofenadine and 1 dose of cetirizine or placebo. And you can see that in the histogram, there is no difference as far as placebo and fexofenadine, whereas, of course, there was a negative result for cetirizine. Now, let me go to the conclusion. I explained in the first slide what trifecta meant. And so we have 3 outcomes and the 3 features. And so the question is, this anti-allergic solution trifecta is true for fexofenadine? I guess that my answer is going to be yes for fast relief. I show the data for the long-lasting effects and for the no drowsy effect. And that I mean that fexofenadine is really a reliable treatment for allergic rhinitis.